Good afternoon. It's 1 o'clock. My name is Marquetta Lipford, and I am covering for Jamie, who is hopefully enjoying himself on vacation. I will be presenting the presentation today for Wednesday, May 29th, as it relates to the hurricane season ahead. I want to apologize in advance because I'm actually en route to training and I am in the airport. So if you hear any background noises, I'm going to apologize in advance for that. But I value your time today, so I'm going to go ahead and get started with this presentation. Of course, there's some basic issues around emergency preparedness, so we're going to just take a look. They're predicting about 23 main storms, 11 of those of which are going to be hurricanes, and possibly 5 of which may be major hurricanes. According to this prediction, the forecasters are looking at Florida and the eastern Atlantic seaboard as opposed to the Gulf. Of course, that's not to say that the Gulf won't be affected by hurricanes. As a matter of fact, you'll see here in the statistics, there's a 56% chance that Louisiana will get some sort of storm during hurricane season. And of course, Mississippi is about a 43% chance. At Mississippi's Gulf Coast, there's going to be some tropical weather. Only a 23% chance that in Louisiana and a 13% chance that we will see a major hurricane in Mississippi. Of course, if you'd like to get more information about that, Jamie has included the links here on the left-hand side of this slide deck here so that you can go in and take a look at the recording, listen to the recording, and also check out that slide deck. These are the schedules that hopefully we'll be accomplishing starting in June. Of course, on June 12th, it's going to be looking at New Orleans and North Shore. The 19th, be looking at Region 3. On June 26th, taking a look at the Mississippi Gulf Coast. And of course, on July 10th, going to be looking at Regions 4 and 5. July 17th, be looking at Baton Rouge and Metro Alexandria. Because they are actually potentially receiving sites for any evacuation from the coastline. July 31st, the medically needy, sheltering Mississippi. And of course, if that wasn't covered on July 17th, they'll be looking at that in Louisiana as well. August, there will be another at-risk tutorial. By the way, that first link, the blue hyperlink there on the top page, is an at-risk registry tutorial that was done on May 8th. And of course, that link is active if you'd like to take a look at that. The suggestion, of course, is that you make sure that everyone in your area gets to take a look at these tutorials just to kind of make sure that they're up to date and that they have an idea as to how to put in the data, and of course, updating the data every week. Remember, the registry requires the agencies do a weekly update and update every one of their patients in order for the patient's names to appear on the emergency manager's Friday morning reports. Of course, if there wasn't an update, patient's name's not included in that. So we have to make sure that we're doing it correctly. I guess in order to talk about updating correctly, so these are some very important questions that hospices and home health agencies in this part of the country need to concern themselves with. Of course, first being whether or not they have submitted the agency's plan to all the parishes or counties that they serve. Of course, you'll see the hyperlinks there for the Louisiana parishes as well as the Mississippi counties that are there. And of course, if you haven't, please make sure that you do. Just as best practices, not only send it to the emergency manager where your law office is located, but you have to, the suggestion is that you also include your entire service area because every single parish, every county does emergency management a little bit differently. I guess the next question would be whether or not you have actually met with your emergency manager, with your parish or county emergency manager. The suggestion, of course, is to meet those folks in person, get to know them, let them get to know you, so that relationships can be formed now so that in the event of an emergency, you will exactly know who to go to. Thirdly, are you using the at-risk registry? And of course, that's a very important tool for you and your agency, to be able to come compliant with the requirements. You have the emergency prep, COPs. Of course, that's in regards to you sending the information to your local emergency manager about the patients that would have difficulty evacuating if there was an evacuation. Of course, this is something that CMS is in high expectation that every hospice and home health agency are able to supply a list of, and the names of those patients who would have difficulties following through on an evacuation order. The links there on that third block are the ABCs, which is a simple 2-page tutorial that walks you step by step of how to use the at-risk registry. And of course, there are some consent forms for both Louisiana and Mississippi, also an evaluation form for Louisiana and Mississippi. Again, those are 1-page, kind of quick and easy, but a great opportunity for us to make sure that you have what you need and that you're able to utilize those tools. Next question, is someone in your office receiving the weekly reminder and completing the required weekly update to the registry? Just in case, there is a link there that has that tutorial for the at-risk registry. Again, just wanting to make sure that we are equipping you guys with all of the tools that you need to make these things happen. Checking out with your parish county officials, whether or not there are reentry placards that are needed for the staff, because we know that there are times when they have to have a placard to get back into those areas. So the only way to be able to answer that question will be to find out from your emergency manager whether or not there are any placard requirements to return to the area. And of course, they can actually help you with that. Transferring the travel contracting hospice patients to another agency. Questions that come up with that are whether or not you're getting paid, and whether or not you are completing the process. This is extremely important, because if you're going to charge patients that are out of your area, you should have made arrangements for your patients to have these services continue outside of your service area. So you can do it by contract, or you can of course do it by other means, but you have to have something in place before any emergency happens to make sure that your patient's continuity of care is being taken care of. Whenever we talk about emergency preparedness, of course, we need to talk in terms of holidays, weekend disasters, because unfortunately hurricanes and tropical storms don't take place Monday through Friday from 8 to 5. Of course, if you guys can remember this flashback here, looking at Hurricane Ida, perfect example how little tropical category 2 rapidly intensified in just a little while, made landfall and went back down to a 2. I mean, you can kind of just see that illustration there. So it kind of gives us an idea of how quickly these things can happen. Talking about tabletop, making sure that you need to take into consideration holidays and weekends when you're doing your tabletops. And of course, with that in mind, the question comes up whether or not you guys have done any tabletop exercises in 2024 in order to get ready to prepare for the hurricane season. Just keep in mind on the left-hand side of the lower page of this screen, there's a recording, a link that kind of shows the tabletop, how to conduct a tabletop exercise in part 1, and then part 2, conducting the tabletop with a plausible scenario for home-based providers to participate in. That, of course, is also another resource for you guys to be able to have. Of course, some of the questions that would be asked from the tabletop: what lessons were learned from previous emergency declarations? Does your planning, of course, include weekend landfall of disaster? Do you have current contact information for all of your staff and patients? Do you know what plans your staff and patients have if they made an evacuation order? Do you know your parish or your county's evacuation plan for your patients? And of course, always, is there a backup plan for communicating with staff and patients in the event that cell phones go down? Because we know that that has happened. And of course, it's certainly not being a possibility that can happen at any time. That being in mind, take a look here. This is what you will receive on a weekly basis, the Watchpoint at-risk registry. And of course, here, there's a link there for you to learn more about using the at-risk registry. And of course, Jamie's information is jboudreau@lmhpco.org. There is a link at the top of this page that says to update that patient list, that this is where you can actually clean that list up. And of course, you receive this with a great opportunity for you to go in and clean up those patients that have not been, that no longer have a need to be on the at-risk registry. This greatly helps to save quite a bit of time, but then also it's keeping things current, and then also keeping the awareness of the fact that things change, and they change very quickly, so that we can definitely be a part of being on top of things. As you can kind of see here, this was the at-risk weekly reminder as of today. Total recipients 1,042, sent out 987, with about 16 that opted out and 39 that opted out of the contact center. So if you take a look down at the bottom, there were 149 of those open, 893 of those that were unopened, and of course, 353 that bounced. And what we try to do is make sure that we have accurate contact information so that we can make sure that these emails are actually going through. I'll pause from here because it looks like I have a chat responding that who takes care of their data. Thank you for that. And of course, you can take a look. The annual maintenance was conducted on May 13th. There were 347 patients removed from the database who had not been updated since January 1 of 2024. So that was quite a few patients that had been actually removed. And of course, as of last week, you'll see there in that column of 522, these were the numbers that were in the number of patients that were in the registry. Total of 2362, 2164 of those being in Louisiana, and 198 of those being in Mississippi. Of that total, there were 1,608 patients that were identified as being in need of assistance totally for Mississippi and Louisiana. And of course, there were 752 of those patients that were tabbed as not needing assistance. And of course, the reminder goes forward to please remove those that are no longer in need of assistance. Currently, there are 91 hospice agencies that have 1,333 patients in the registry. 813 of those need assistance, and the additional 520 either don't need assistance or have not been updated. There are also 87 home health agencies that have over 1,000 patients in the registry, with the majority of those needing assistance, and a very small number in comparison that either don't need assistance or that have not been updated in the last week. There are 30 agencies that have not updated, 217 of those in Louisiana and 30 in Mississippi. This was as of 522. 67 agencies that did not update, 752 patients last week. And of course, there were 46 patients in the registry that were missing the parish or the county, and also zip codes, which are vital statistics to have, because I think that kind of links to the areas as to specifically where these folks are that are in need of assistance. There's some new regional reports that are available for regional emergency managers. They have access to the at-risk registry. Of course, in the login under the Choose Action drop-down, click on the last report, WPAAR Regional Report, and then click on Download. And of course, remember that these weekly parish and county distributions come out Friday mornings at 7 o'clock. And then the regional report distributed, on Fridays at 8 a.m. And of course, Crystal Birmingham, cbirmingham@mums.com is available if you need assistance with the regional login credentials. Of course, here is the state of Louisiana and the 9 parishes. And of course, according to each region, it has listed there the folks that you would probably need to reach out to for each of those individual areas. And of course, this is the Mississippi Emergency Planner. And of course, it shows those emergency planners along with contact information. Just so you know, Teresa Jones actually heads the Healthcare Preparedness Program Director for the state of Mississippi. There's her contact information there. And I know that they regularly have those coalition meetings and trainings. And of course, if you need information as it relates to the state of Mississippi, please reach out to Teresa. These, of course, are the emergency preparedness nurses and the map for the state of Mississippi and all 9 of those districts there. And these are the emergency response coordinators for each of those districts in the state of Mississippi. The LAES 8, ESF 8 administrative regional coordinators are listed here. I don't know if we have anyone on the call today from Region 2. I think that Allison was on last week. If there's anyone on for Region 2 and you'd like to share, I have the alert social media links here. I'll pause and see if there's anyone on that kind of wants to go over that, and then also the fair that's coming up June 1st.
What were you, I'm sorry, what were you asking about if we wanted to go over for Region 2?
Yeah, if there was anyone available from Region 2 that just wanted to talk about the fair that's coming up. I think it's June 1st. Am I correct?
I was trying to get information on that too. I am in Region 2,
Okay.
Home Healthcare 2000, but I was trying to get info on that too.
Okay. Allison, would you happen to be on today? And that's okay. If not, I can show you. This slide here is actually showing the information about the resource fair. It looks like it's going to be Saturday, June 1st from 11 to 1 at the main library on 77 Goodwood Boulevard. And of course, this is a free event. Free resources will be available: first aid kits, emergency plan guides, of course, pet preparedness items, weather guides, and on-site preparedness experts. So it looks like here says, please email the below information to redstickready@brla.gov to reserve your space as a provider. And of course, Tara Zachary. Tara, would you happen, I don't know if anyone else may be on to kind of speak to this a little more, but here's Tara's contact information if you guys want to reach out for more information regarding Saturday's event, the resource fair for the 2024 hurricane season in Region 2. Are there any questions further on this? And of course, moving towards hurricane season, want to make sure that we got necessary tools for operation. Region 2 Parish Offices of Homeland Security and Emergency Preparedness are no longer using the Capital Area Ready credentialing system. Says Region 2 parishes should follow the www.capitalaready.com, should follow standard post disaster, re-entry credentialing recommendations. All personnel shall possess a business letter on company letterhead stating the following: of course, the name of the employee that's seeking re-entry, driver's license, description of vehicle being, company identification, and contact information for the manager of that employee. So this is actually talking about the readmission into these areas in Region 2. These are some of the requirements. Region 3, this is a notification / social media sites for the Region 3 area. I don't know if there's anyone from Region 3 that wants to speak to this or have any questions or concerns. And I apologize, you guys will have to just speak out because as I'm sharing the screen, I can't see if you have a hand up or if you have a comment. Here, of course, is Region 4, alert and social media links. And for the remainder of 2024, these are the Lunch and Learn topic dates of things that have happened and are going to be happening. Looks like there's a few more that are on the calendar for June. There are 3 coming up in June. So this may be something that you guys may be interested in. Of course, the Zoom and registration link is listed on the right-hand side of the screen. And of course, you guys will all receive this PowerPoint presentation at the close of today's session. I'll stop sharing my screen there and make sure that I haven't missed an opportunity to answer a question or take a comment from someone.
I have a quick question. The administrator of our that maintains the at-risk registry for us, she sent me an email this morning, and she said as of yesterday, I cannot seem to get into the website for the biweekly survey. Never had this problem before. Can someone tell me what's going on, and is that still an active part of is the survey still an active part of maintenance, or?
So Shelley, this is what I'm doing right now because I can't directly answer this question. I am taking this down and I will definitely follow up. Do you mind to give me, or do you just want me to reach back out to you with the answer to this once I find out for you?
Sure, that would be great.
Okay. And that question was, of course, making sure that the biweekly survey was still available. Was it still a part of the cleanup? Is that correct?
Yes.
Okay. Gotcha. Okay.
Thank you so much.
You are so very welcome. Does anyone else have any other questions?
Yes, hi, good afternoon.
Hi.
This is Sherry. I have a quick question. I have an office manager because I'm like over more than one location as a director. So she handles a lot of stuff for me, clerical wise and stuff like that. How can I get her registered to be able to enter all these things so it won't be all on me, and she can assist with those things?
I would most certainly say shoot Jamie an email with her contact information on that so that she can be actually added as the go-to contact / person that could kind of help carry the weight of that. Definitely. It's jboudreau@lmhpco.org.
Okay.
If you want to give me her name, I can follow up if you'd like for me to. Do you need me to shoot your email a reminder?
Yes.
Okay. Sherry, give me your email address and I'll definitely take care of that.
Yes. My email address is, I just changed it.
Okay.
It's Sherry, SHARRY @apexhospice.org.
apexhospice.org. I got it,
Yes.
Sherry. Okay. I will definitely make sure to follow up with this for you. Thank you.
Thank you.
You're very welcome. Is there anyone else that has any questions or anything that I may refer over to Jamie if I can't answer? Well, listen, I know you guys' time is valuable. Thank you so much for taking time out, and thank you for all that you do in keeping the at-risk registry updated, and of course, staying vigilant as we go into hurricane season. Thanks so much, guys. Jamie will be back not next Wednesday, but the following Wednesday. So I'll be with you guys again on next Wednesday. And of course, in the meantime, if there's anything I can help you with, I am at Marquetta. That's MARQUETTA @lmhpco.org. Thanks so much, guys. You have a great day.